Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, not all medical research is created equal. I'm going to show you how to know what's real and what's not. And then we're doing a plastic surgery rapid fire recap of previous segments. This one's going to be good. And then finally, 2025 VMA fashion. Sarah's going to teach us all about it, and it's coming up right now.
This is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Sarah, as always.
Hi.
How are you, Sarah?
I'm good.
In the box, we got Brenna. How are you today, Brenna?
Hello. Good. How are y'all doing?
Hey, make sure your mic's working. Remember, we got to make sure your volume's
Oh,
up.
it's on.
Okay. I meant to tell you that, and I forgot. So you doing okay?
I am. How are y'all doing?
We're doing good. It's Friday. It's always a good day when we're having a show because it's Friday, rolling into the weekend.
Yes, we are.
All right, we're going to roll into our segments right away here because we've got a lot to cover. Surely you guys have been on the internet before and you've seen a product or some treatment and it says, this is backed by research, right? Mm-hmm. I mean, you see that literally all the time. So, when it says that, I mean, I personally, knowing what I know, think, okay, well, what does that mean? Like, what does it mean that it's backed by research? Because a Petri dish study is a lot different than 1 million patients in a real big clinical trial. So they're not all the same. So we're going to do a segment today. Not all medical research is created equal. And my goal here is to try to educate you guys in the audience in what the different types of studies are and what they mean. Because I'm very cynical when I see new treatments and new products. And even when people come by my office trying to get me to use stuff, I'm always like, what does the research show? And they're like, oh, we have all these research papers that show this and that. And on first glance, when somebody says that, you might be like, okay, well, they got research papers here, but what do they mean? So I'm going to kind of go through these just to give you guys some optics of like what to look for when you're shopping out there, you see a product, you see treatment, it says research backed. Okay, so there is actually a hierarchy of evidence. I actually brought a pic of it. Brendan, can you throw that second picture up there? And you don't have to memorize this, but this is basically the pyramid showing at the bottom what's kind of like the worst types of research going up to the top. I'm just going to recap them real quick. And a lot of these you won't see for actual products. Some of these are more medical research that wouldn't necessarily pertain to like a product or treatment, but just having like a good overview is a good idea. So we start out with like the low level stuff. So this would be considered really weak evidence. So that would be things like a case report. So a case report is basically if I have a patient that had some weird finding, I'm going to write about it and I'm going to submit it to a paper, and that's considered research. That's a case report. Very, very weak evidence because it's one patient, one doctor. There's no like control or anything like that. Opinion papers are very similar. That's me basically writing about a topic I know about. So I'm going to write about plastic surgery and I'm going to send it to a journal. Very, very low as far as like the level of evidence. In vitro studies. So this is when I say lab research. You've heard me say that, right, Sarah? I said this, this product says it has research. Well, it's lab research. Okay, so what lab research generally means, because me saying lab research is more of a generic kind of term. The proper term would be in vitro studies. So what in vitro study means is done in either like a test tube or a petri dish. So I'm going to put a couple of cells in a test tube, and then I'm going to put a chemical in there and see how that chemical affects these cells. That's what a lot of treatments these days or products actually back their evidence on, is actual in vitro, or what I like to call lab studies. And yes, it does kind of give you some idea of what a product or a treatment might do, but it's the most rudimentary, basic kind of indication of what that outcome might be. And so a lot of, doctors look at lab studies and are like, well, okay, great, but what else do you got? The next one would be animal trials. A lot of products do use animal trials, and I'm sure you guys have heard of that. The issues that you have with animal trials are two things. One, treatments or products that have an effect on an animal absolutely do not necessarily correlate to humans.
Yeah, don't they usually test on animals first anyways, though?
It just depends. There's a lot of pushback these days about animal research. And then, doctors and scientists will push back and say, well, insulin was actually developed through animal research, and that saved millions and millions of lives. Okay, but so there's a little bit of pushback on animal research today. I'm kind of on the fence of it because I am kind of an animal person. But then again, if you can save 100 million lives by doing some research on rats, I think most people would probably be okay with that.
Yeah.
But the issue is that's just kind of a starting point because, as I said, treatments and medications that work on animals don't necessarily have the same effect on humans. So if your whole product line is based on animal research, then it's not good. That's really, really weak evidence. And so that's one of the things that people should look for when they're talking about treatments, whether it be skin products. And I'm relaying all this to the aesthetic world, but that's what our show is. Products, treatments that have animal lab research, not necessarily good as far as the level of quality of evidence. And further, a lot of times things that don't negatively affect animals will negatively affect humans.
Yeah.
And there was a really famous one, I want to say it was Vioxx maybe, don't hold me to that, but there was a drug that was animal tested that when they got into humans, it really had some bad effects. So those are all the low-level ones. So then the mid-levels will be probably not what you would see in the things that are aesthetic related. That would include things like cross-sectional studies. That's just observational research that gathers data from a single point in time to make associations. Case control studies, those are a little bit better. That's where you have basically two groups of people, one with a disease or condition and one without, and then you identify risk factors looking back in the past to see, okay, what did the people in the group that had this issue have differently than the people who didn't? These are more mid-levels. And then cohort studies, that's an observational study looking at progression over time. So the mid-levels, cross-sectional studies, case control studies, cohort studies. I always have to, in my mind, either think through those or look them up. Even as a doctor who's written research papers, I still get confused about those. So I imagine you guys are probably like, wait, what? For the most part, just remember those are just mid-level, not bad research. A lot of medical, aesthetic treatments are probably not going to have those anyway, but that's considered the moderate evidence. So then you move to the high evidence. These are the ones that I want to see when I'm looking at a new surgery, a new product, a treatment, a drug. I want to see randomized controls trials. Have you guys heard of these RCTs? You probably have, with your background. Yeah. Do you know all these?
Yeah, kind of. I was wondering where peer-reviewed studies would be on that.
So they all should be peer-reviewed. So to me, peer-reviewed, it just means that, other people within your profession have looked at them. They should all be peer-reviewed. Now, that just kind of goes without saying. These are more like the actual type of study, and then each individual study should be peer-reviewed.
Yeah.
That means people look, and we do that, when we're doctors in training, we do what's called journal club, and we would peer review stuff, not officially but unofficially, where we read a study. And my favorite thing to do is look at a study and tell why it sucked, because I have this feeling that a lot of studies are just poorly put together. I firmly believe this from looking at studies my whole life. A lot of research is just not great. The methods are not great, the conclusions are not great, and so I love to pick apart a study. So I'm an unofficial peer reviewer, but peer review on an official platform would be the people who are part of the journal.
Yeah, the journal of
the journal peer
blah,
review.
Blah,
Yeah,
blah.
peer review. So yes, peer review is very important because that way someone else is looking at it. Because this all goes to what I'm talking about is that if I just send a study to somebody who's not in medicine or not research or health backed, they don't know if it's a good study.
Yeah.
So you get peer reviews to make that call. But randomized control study is the gold standard. Patients are randomized into two groups. One's placebo, one is treatment. Double-blinded is best. So double-blinded means that neither the patients nor the person that's running the study knows if they're getting the placebo or the actual drug. So that's a randomized double-blind study. That is the best. And then above that is meta-analysis and systemic reviews, where someone takes 10 or 20 RCTs or randomized controlled trials to get a big picture over one topic.
Okay.
So those are the absolute best. Randomized controlled controlled trials being the absolute best singular, and then meta-analysis or systemic reviews looking at multiple. And so, okay, so what does all this mean to you as the consumer, you guys looking to, to learn something? Well, if you're looking at a product or treatment and it says, okay, research backed, but you feel like maybe this is new and you don't necessarily believe it, or maybe the results are too good to be true, look into the type of research. If it says in vitro studies, animal studies, any type of thing like that, or case studies, it's garbage. It's almost like it doesn't mean anything at all. Like that's how low level it is.
It's really easy to make a paper say what you want it to say.
100%, Sarah. That's why peer review is so important, because you're exactly right. And you also should be aware if you find out that the person that did the study is the company that's making the product. Now that does happen. It doesn't always mean it's bad, because a lot of times companies will get an independent group to do the study because they want research. So like, look, we're going to pay for this, but we're not going to do it ourselves because that's bias. We're going to have someone else do it. But you need to at least be aware of those things. And then pay to publish journals are the other thing. A lot of the pandemic stuff that was really questionable came out of pay to publish journals where no one really reviews it, and you can just write a paper or study and it can be absolute hot garbage, and this journal will publish it. So it's not like a legitimate journal, it's a pay to publish journal.
Fancy.
Yeah, but it makes it look real. Like, oh, I did this research, it's in this journal article, it's legit. And then you look at it and it's like total crap. So I do think this is important. This is probably the most boring topic we've ever done, but also probably one of the better things that you could learn from an educational standpoint to know if you're looking at something new, a treatment, a drug. And the drugs that come out, the official drugs like Pfizer drugs, they've all been through all of these, so they're very, very well tested. But it's the kind of off-label stuff, the aesthetic stuff that you don't know.
Yeah, like supplements too.
Oh, supplements are huge. Supplements are almost always, very low quality studies. We've talked about that, and that's why I kind of, decided to do this. Is we always are dancing around the topic of like, is this good research or not? But this is like the segment where we kind of break it down. And yeah, I know it's boring. It's probably the least exciting segment we've done, but it is good information. So
yeah, agreed.
Nice. All right, let me recap this real quick, Brenna. So today we did a actually very informative, maybe not quite exciting segment about the quality of research when it comes to medical things such as different treatments or medications. You see this a lot in the aesthetic world where something will come out and it'll say research backed. Well, what does that mean? Because there are an enormous amount of variety and qualities of research. And what I found, a lot of these new products simply have in vitro studies, which I like to call lab studies, which means the research is in a test tube or petri dish, which doesn't necessarily correlate to humans whatsoever, or it's animal research where they test these products on animals, and again, that doesn't necessarily correlate to humans. We in the medical world consider these to be very low quality studies. Now there's a whole pyramid, but you want to get up to the very top where randomized controlled trials are. That's where you have two groups of people, one that does a treatment, one that does not, and you see what the outcomes are. And they're randomized, they're blinded, nobody knows if they're getting the real treatment or a placebo, and that is the absolute highest level of research. So I know this topic's not very exciting, but as you as the consumer who may not necessarily know a whole lot about medicine or research, if you just know that there are different qualities of research out there and know that just because something says it's research backed doesn't necessarily mean it's going to work, I think you've learned something important. So, all right, thank you. Okay, moving on. So trying a new segment. This is going to be rapid fire, short segment, plastic surgery stories. Some of these we've covered before because they're updates. So I'm just going to tell this story really quickly, and I'm going to see what you guys think about it.
All right.
All right, this is a new segment. I like to try out new stuff.
Good.
All right, Brittany, you're going to have to weigh in too, all right?
Okay, I will.
Are you ready? Okay,
I'm ready.
All right, I'm going to start. Give me the camera here because I'm going to start these out. Okay, for our first plastic surgery rapid fire short segment. So this actually is pretty interesting. So the UK government is now turning to TikTokers, employing them to put out the word about the dangers of medical tourism, because in the UK there's a huge amount of people that are traveling to Turkey to get plastic surgery or even medical surgeries that are not aesthetic related, and a lot of these people are getting super jacked up. We're talking botched to the very worst degree. People are dying over there. They're coming back to the UK. They're having horrible complications, which then is putting pressure on the NHS or the Nationalised Health Service, and that's why suddenly the UK government's like, hey, we're spending a lot of money on people that are going out of the country to get plastic surgery. And if we say, don't do this, no one listens. So now we're going to employ influencers on TikTok to put out the word about the dangers of this. What do you guys think, Sarah?
I think that's a smart idea. Don't they have citizens get medical care for free, right?
Correct, right. And so that's
it's
why
costing them a lot of money.
It
fix
is.
people's
And I
mistakes.
saw some data on this, and we did a segment about this, and I actually pulled out how much money it was costing the NHS. And it wasn't like billions of dollars, but it was a notable amount.
Yeah.
And so now they're taking note. Look, we're having to pay for these complications. These patients aren't going back to Turkey to get their complications dealt with. They're going to the NHS
Again,
hospital.
and then they're going out of their country to get elective surgery.
Correct. Yeah.
And then it becomes an issue that's not elective to fix.
Absolutely right.
So then they have to pay
Absolutely
for it.
right. What do you think, Brenna? Employing TikTokers to talk about medical tourism?
I think it's definitely strategic.
Ooh, I like that.
But-
Strategic. Yeah. I think it is
Yeah.
too.
They know where to find people, the audience.
And those people have an audience that listens. Who listens to the government? I
Right.
sure don't. If the
Yeah.
government tells me to do something, I'm probably going to do the opposite.
And where do you go to? Because not a lot of people, I feel like, watch the news as much anymore.
Yeah.
So,
No,
That's
they're
true.
getting their
Yeah.
information off podcasts,
right.
YouTube, TikTokers. I mean, I think it's actually a really smart move by the UK government.
Yeah.
Actually, I don't usually say UK government, good job, because I think they're terrible, but this time,
A thumbs up.
UK government, good job. All right, let's move on to the next one. Okay, so our next kind of rapid fire plastic surgery story is an update on a topic that we did in the past. Brenda, you're probably not going to remember this one. Sarah, you will.
Okay.
Remember Dr. Ben Brown? He is the plastic surgeon in Gulf Breeze, Florida, that was operating on his wife, and she went into cardiac arrest and she died.
I don't remember that, but I
mean, we've had
am
so many stories that are similar.
from
Yeah.
Florida.
Yeah, from Florida. Okay, so this update on Dr. Ben Brown. This is a plastic surgeon in Gulf Breeze, Florida, who was operating on his wife, and she had some complications during the surgery and went into cardiac arrest, and she ended up passing away. And we talked about this probably 3 or 4 months ago, I think. And we kind of broke down what may have happened, but we didn't have all the details. But obviously, it was kind of a crazy story.
Mm-hmm.
And I had kind of speculated that they did her surgeries under local, and because of the symptoms she had, that she'd had a seizure from that. So there is an update. It's worse than we thought.
Oh, gosh.
Now that Dr. Brown has been investigated, there's been a lot more people come out and say that they had these, malpractice events from him. This is not unexpected. Anytime a doctor gets some high-profile, newsworthy bad outcome, you then will get people coming out of the woodwork saying, "Oh, he, did this." I was more shocked by the details about what happened to his wife. According to people who were there, she was undergoing 5 procedures in one day. Which is
Cool.
absolutely insane.
Oh, that's scary.
And it wasn't specifically stated, but I can confirm now it was done under local because they said that she was awake. And she started seizing, which is almost certainly due to overdose of local anesthetic, because that's the first thing that happens when you start to get overdose on local anesthetic. And then she started to basically go down the tubes, and this is the worst part. According to the people that were there, they wanted to call 911 and he refused.
That's scary.
I don't remember that when we talked about. We've had incidents like that in the past,
Yeah,
but
there's been I think most of the doctors have been like, no, let's wait.
some of them did for sure. I didn't remember this about him, but yes, apparently she was in cardiac arrest. He was doing CPR and he didn't want them to call 911. And someone actually called 911 before he said that it was okay to. They're just like, look, I feel super uncomfortable with this. I'm calling 911. And so then she ended up going to the hospital where she ended up dying. This is a really bad story. It was bad the first time I went around. I think it's even worse now. I mean, unacceptable, I think, to do 5 procedures on someone in one day, especially if they're under local. I hate doing any type of large procedure under local. There's a lot of risk with that. maybe one small procedure or one medium procedure, sure. 5 procedures, no way. That's just, to me, out of bounds. And then
scary.
It's scary, right? And then she started having complications, and he refused to get help. Like, this guy's done. Like, right now he's under investigation by the Florida Medical Board. I think there's no way he doesn't lose his license. Like, I don't know. We'll see. I mean,
He'll
we'll
go
have to
move to another country to perform weird surgeries.
potentially
there.
move to another state, but yeah, I think that story is terrifying. He is a actual legit plastic surgeon. Normally, a lot of the times when these really bad things happen, it's not plastic surgeons, but this guy was or is. Yeah.
Got too big for his britches.
Yeah, I think so. Yeah, terrible. Okay, last one. Sorry, go ahead, Brenna. Were you gonna say something?
We have a couple comments.
Oh, what are they commenting about?
Cindy said, I think you should get on the TikTok plan and get paid by the government. Oh, wait. I think you should get in on this TikTok plan and get paid by the government.
I should. I wish the U.S. government would pay me to do that. Yeah.
Yes. And then she said, why would someone not just pick up the phone and call 911? Folks don't need anyone's permission to save a life.
Good comments. I agree with that.
Yeah.
Very good. Okay, last rapid fire. All right, so this is about a celebrity who's claimed that she is not going to use Botox, and her plan is instead to just get a facelift when she turns 45. Paige DeSorbo, 32-year-old reality TV star and podcaster from the Giggly Squad. I've actually heard of that one.
I've never heard of it.
I've heard of the Giggly Squad. Said that she is skipping Botox treatments. She's not going to get them, and instead she's just going to get a facelift when she turns 45. So I'm going to tell you that that's not going to work because Botox and facelift do different things. They both make you look younger, but they go about it in different ways. Botox prevents the muscles of your glabella area between your eyebrows, and then the muscles on your forehead and the muscles around your eyes, called the crow's feet, wrinkles, from forming. And so when you use Botox, those muscles don't work, the wrinkles don't form, and you look younger. A facelift does something totally different. A facelift lifts the mid and lower face and the neck. And so that has absolutely nothing to do with any of these wrinkles here. And so her plan is a bad one. And I just wanted to point that out because someone might look and listen to her podcast and be like, oh, I don't have to have Botox. I can just get a facelift at 45. Yeah, you can get a facelift at 45, but you're still going to have all these wrinkles up on the top.
Yeah.
And it just ain't going to work.
No.
So I think that, I've always said this, Botox is the lowest hanging fruit for staying looking younger into middle age and older age. I don't say that to make money on Botox, because we make very little money on Botox, but it is a great way to keep looking young, and just getting a facelift is not going to work. So,
Yeah,
you like Botox, right?
I do.
Yeah. I mean, you're kind of new to Botox. Do you?
I think I've been getting it for like 2 years now, right? I feel like.
Have you? Has it been that long?
Yeah.
Maybe
I just
so.
don't get it as often.
Maybe so. Brenna, are you going to use Botox? That's a personal question, but we answer it.
I don't think so.
No?
I don't know. I haven't gotten to the point yet where I'm
No,
like,
you don't need it now.
Yeah.
You're still too young. But like when the time comes, are you going to get it?
I don't know.
Not sure. Okay. All right. Well, if you ever need any information about it,
Okay.
I'll give it to you.
Good to know.
You know
I
somebody.
never thought I
you know
would
a
get
guy.
Botox
Honestly,
either.
by the time we do about, another year of these episodes, you'll be like, yeah, I'm going to get it.
Yeah, I might be swayed.
You're going to be converted.
Right.
Okay. Sarah, you're going to talk to us about VMA fashion?
Yeah, real quick.
Yeah.
Let me
I
get
know
my
that
stuff.
we're kind of running over today, but I definitely want to see some of these. So let's do these on a
Okay,
rapid fire.
so the VMAs were on September 7th, and
Oh, it's been a couple weeks. It's been a
Yeah.
hot minute.
yeah, these are my note cards on my phone, on my
No,
notes
that's cool.
app.
Yeah, no, I know. I mean, I think it's better to do it. I
Yeah.
use old school note cards, but digital is fine.
So let's get right into some
Yeah, let's do
fashion
it.
highlights. We're embracing the sheer look. So the first picture is of Tate McRae.
My queen.
yeah,
Brenna just saw
I
Tate.
did. I saw her last night.
She saw her last night in concert.
she's
I did.
in white silk. Oh, that's cool.
That is a very nice dress.
I love it.
It's sheer, right? Is it sheer satin?
It's silk chiffon
Wow.
dress by Ludovic de Saint-Cernin. And she's supposed to resemble a Greek goddess, which she does.
I think she does.
She looks good.
Brittany, you're gonna have to text me her name, or one of you guys, so I can
Oh, I
check out her
will.
music. She's a musician, right?
Yes.
I want
Yeah.
to check it out. I always like to see new artists. So.
The next is Zara Larson.
She was the opener for Tate, so seeing them back to back,
Yeah.
I'm loving it.
Wow, look
she
at that
is
outfit.
doing some sheer.
It kind of is giving what she
She
wears
looks
on.
like Eve. Like she reminds me of like Adam and Eve or something.
There's not a lot to that outfit.
Very
Kind of
hiding
the
behind
Little
a bush
Mermaid, like the
situation.
different not seaweed, like underwater
Yeah.
coral.
And then Nikki Glaser, she is a comedian, and she's wearing sheer. It's just black.
Okay. I
Yeah.
think the second one was my favorite. That was a pretty amazing
Of
outfit.
course it was.
Yeah, I like that one.
Okay, and then we have some archival vintage fashion. First up with Tyla, and she's wearing a vintage Chanel.
Like a true vintage?
Yeah.
Oh, wow.
Vintage
I
Chanel
love vintage stuff.
dress. It's very mini.
I really like that.
It's very cute. I think she accessorized it well.
Yeah.
She
And
looks
vintage
cute.
is just cool. I mean,
Yeah.
wearing vintage stuff.
It's from 1993. It's a top,
I hate to hear that 93 is vintage,
and
but
she's wearing it as a dress.
she's wearing it top as a dress?
Yes.
Nice.
And then we have Lotto. I don't really know how to say her name correctly, but she is wearing a Giovanni Versace dress, which is also a vintage
Wow.
dress.
Was there a lot of vintages at the VMAs?
I think so, just because, I think there's always vintage fashion whenever
Yeah.
you go on red carpets. That's like a classic thing to do.
I think it's super cool. I love vintage stuff.
And then we had some standout and dramatic looks coming in with Doja Cat. She's wearing some checkered mini dress
Those
from
shoes.
Balmain.
I know, I was going to say the shoes are like the first thing I saw.
Holy
Yeah, her
shnikes.
shoes and her hair is also, she's wearing a wig.
She's wearing a wig?
Yeah, it's a blonde wig.
Oh, okay.
And then we have Conan Gray. And he is
What in
wearing,
the world?
or they are wearing, nautical-inspired ruffled sailor hat and
Dress?
dress. So
I'm not a
they
fan of that one.
went all out for their outfit. Not a fan of it either, but
I mean, it is noteworthy.
it is fashion. Then we have Sierra, and she is in, I don't even know how to say the name of the outfit she's wearing, but there's the vibe is sporty. Like she's evoking sporty spice in this little outfit. I forgot, I can't say the name of the designer. Shia Pirelli.
Let's see.
Shia
Yeah,
Pirelli.
Shia Pirelli.
I think I'm liking the
Pirelli.
shoes. They're like, I think they're just like black on the tip, but
Yeah.
they're clear.
Yeah,
Yeah.
those are nice.
And then we had some coordinated monochrome moments
Okay.
from the fictional K-pop group Huntrix.
Oh, the K-pop
and they
hunters?
were there. So the next picture is
Like, how
them.
were they there? Oh, that's the
They're
voice
the
actors?
voices
Oh.
and the singers for it.
Oh, they look cool.
Yeah. So they had like a cool little outfit going
Yeah,
on
that looks
together.
nice. They look like-
They look the part.
They look like
like
K-pop.
demon hunters.
Yeah.
And then there were some social things that were kind of cool about the MTV Awards, which usually are. So Taylor Swift wasn't there. And
She
we
was not?
There's the next picture is of Taylor Swift from like another time. She won all of those.
So why
MTV.
wasn't Taylor Swift at the VMAs?
She was nominated, but she didn't get anything.
Uh-oh.
So,
It's changing in the guard.
I'm not happy
and
about
she
it.
also
Are
wasn't.
you a Swiftie?
Yeah.
She
Oh,
also wasn't
okay.
at the football game that was that weekend either.
Maybe she's
I
pregnant.
saw like rumors that she was because there was like a big wall that was.
Yeah,
There was, like,
but she
behind
might
the
have been
scenes, but there was no
preparing for her
evidence.
like album coming
Yeah,
out.
that is true.
Yeah,
She's got
she's a
stuff
busy
filming.
woman.
on.
Like I've seen like music video behind the scenes stuff, but I feel like that should be done already because it's in less than a month.
Yeah.
Yeah.
I like Taylor Swift. I'm not a Swiftie, but I appreciate her business acumen, and I think
Yeah.
she's a good musician.
Yeah, for sure. Then we have Ariana Grande. She got an award, but she accidentally broke it.
Oh, I saw that. I saw she
Yeah.
dropped it. Did it actually break?
Yeah, visibly, it broke the Moon Man,
Oh, no.
but it was awkward and silly, so she pulled it off. She's so tiny. She's like 5 feet tall and
Is she
probably
really?
weighs like 90 pounds.
Yeah.
She's so tiny.
I like Ariana Grande.
And then Sabrina Carpenter was a performer, and she embraced Britney Spears pretty much like the
Yeah.
whole time she was there. So Britney Spears had a similar outfit to this before. So I think the next picture is who she was embracing, the outfit vibe she was embracing.
What
This
year was that
Oops,
from?
I Did It Again. This was like, I don't know,
01,
2001.
02. Yeah. I wonder what
And then the next outfit is of her performance, the next picture. So this is Sabrina Carpenter.
I just don't really like her music.
Sabrina
I
Carpenter?
thought she was Brittany in this. I was
Brittany.
like, is this the old photo?
No, that's
I
Sabrina.
realized,
And then
yeah.
the next picture is her.
Wow.
Oh, wow.
Her and Brittany
Very
side by
similar.
side, and they were wet on stage, rain and everything, so it was
Dang,
very
that's crazy.
Brittany.
Wait, was
So-
Chappelle Roan there?
I don't know,
Oh, okay.
probably. And then Lady Gaga won the Artist of the Year.
She did?
Yeah.
I didn't even know she had a new album out.
And she says Lady Gaga won Artist of the Year. The historic VMA winning tie between Beyonce and Taylor Swift remained unbroken. So that, I mean, I think they were just noting that nobody has ever, since Taylor Swift and Beyonce, nobody's ever gotten like
a
tied.
tie. They'll probably never do that again. It was
Yeah.
such a cluster.
Yeah.
There's another Doja photo. Did
Oh
you-
yeah. Oh yeah. Oh, I forgot. I skipped that one.
I'm intrigued by it. That's why.
Yes, we need that one. Okay, so Doja Cat, she is advertising for her new lipstick with MAC. So she was going around on the red carpet eating it.
Eating it?
Yeah, but apparently it wasn't real lipstick, but she was still like pretending. So, and everybody was like, what's wrong with you? And I'm like, I don't think she needs an excuse. She
No,
can just do
just
whatever
does-
she wants.
Yeah, she does what she does. Yeah.
So yeah, that was the recap.
Those are really cool. I love that. I think my favorite was who was the second girl?
That opener for tape.
Zara.
Yeah, Zara.
Yeah.
I think that's the best outfit.
Zara
Although I did
Larsson.
like the Sabrina Carpenter throwback to Britney. Like that was
I
cool.
did too.
I'd like
That
to.
was
I wish
cool.
I liked Sabrina Carpenter's music. I've actually listened to a bunch of. I'm just like, yeah.
I get to see her. I'm going to ACL, the music festival, with my
Are you
sister.
really?
Yeah, and
Nice.
she's the headline for day
Yeah,
2.
yeah.
So
Excellent.
I've been like forcing myself to memorize everything, so I won't be.
You won't look like a dummy out there.
Yeah,
Like
right.
I don't know.
I
this
don't know
song.
if she's gonna play a lot of her new songs or she's gonna
Yeah.
do more of her like hits, like
Sure.
Espresso and all that. So
Nice,
Yeah.
nice.
yeah.
All
That'll
right,
be
well,
fun.
Sarah, thank you very much for recapping the VMAs. Always enjoy your fashion segments and your expertise in that. So I think that is all the time we have for today. Please leave us a comment. Let us know if you would like us to talk about any specific topic on the next week's episode of Nip Talk. We'll see you then.
Bye.
Bye.